Upon entering the room, proper hand hygiene performed. Good evening, Daniel. My name is Jeff. I'm going to be the Jacksonville State nurse practitioner student examining you today. We're going to do abdominal musculoskeletal exam. Okay. For both of these examinations, I'm going to need you to take your shirt off. Is that all right? And then once you lay back, I'm going to get you lay back, and then we're going to look at that. Go ahead and lay back. I'm looking at the abdominal area for symmetry, masses, hernias. Chin to chest for me. Okay. In this position, you can go ahead and lay your head back. This position kind of helps me see any masses or hernias better. I'm going to go ahead and listen to your quadrants and your abdomen. Just listening for bowel sounds. Sorry, the stethoscope is a little cold. Just going to listen to all four quadrants. Okay, bowel sounds active and present. Next, we're going to move into percussion. I'm going to percuss the abdominal area, listening for tympani should be heard. And we're going to follow the colon. Okay, so now we're going to palpate for the liver borders. What I'm going to do is palpate from tympani up to dullnus and find the borders of the liver. Okay, we're going to start up from the top, work our way down, going from resonance to dullnus. Okay, I'll make a mark here. And we're going to do the same thing here in the center. Make a mark there. And then same thing up here, looking for dullnus. Okay, and these are the markings for the liver, and looks like they're within range. Okay, so now we're going to percuss for the spleen, tympani to dullnus, and there's the spleen. I'm going to go ahead and mark that for later. Alright, and now I'm going to percuss for the gastric bubble, and that's just where should be where the stomach lies right there. Okay, now we're going to go into light palpation. Palpation is going to help me feel any masses or hernias. Sorry, and I'm going to just work the quadrants in a circular motion. This is just light palpation. Okay, any tenderness or pain there? No masses or anything felt there. We're going to go into deep palpation. It's just a little bit more firm, a little deeper, and this will help us feel any masses or hernias that wasn't felt with the light palpation. And then I'm going to palpate around the umbilical ring. No masses felt there either. All right, so now we're going to palpate and feel deep palpation for the liver. Okay, so I'm going to get you, yeah, there you go. I'm going to put my hand under you. Sorry, it's cold. And I'm going to palpate for your liver border, okay? And I see the markings, so it helps me find the liver quickly, okay? Liver is palpable and within expected range. I'm going to go ahead, since I'm here, and palpate the right kidney. Let's try it. Deep breath in. Okay, that's good. All right, kidney felt. It is firm and round within expected range. I'm going to go ahead and reach across here with my left hand and feel and palpate for the spleen. Same thing, we're going to do a deep breath in. The spleen is not palpable, and that is within expected findings. And we're going to go ahead, since we're here, and go ahead and try to palpate for the kidney. Kidney is not palpable, which it is an expected finding. I'm going to go ahead and do a palpate for the gallbladder. And the gallbladder I do not feel. It is non-palpable at this time. And now I'm going to palpate for the aorta. And I'm going to do like a little pinching motion. We'll have the thumb on one side and the fingers on the other. Pulsations are noted. No abnormal finding there though. Okay, if you will sit up for me and turn your body this way. I'm going to go ahead and palpate or percuss with the kidneys. Any pain there? Nope. Okay. All right. If you will, you can turn back towards the camera. So now we're going to move on into the musculoskeletal portion of the exam, and we're going to work our way from your hands up to your head and then down to your feet. Okay. Alright, so we're going to start with your hands. Hold out your hands. We're going to do unilateral. We're just going to work on one for this video. We don't have time to do both bilateral, but in a normal clinical setting, we would do bilateral. Okay, so I'm just going to look. Turn your hand over for me. Okay, good. We're noting any abnormalities here, any masses, and I'm going to also palpate. And we're going to do this throughout. So we're noting any redness, tenderness, palpation, masses, crepitus, or swelling or anything like that. None noted here. So now we're going to do some motions, just test your range of motion. So just follow this with me. First we're just going to do just fingers down, fingers up, okay, wrist up, wrist down, okay, push against me, okay, bring your hand up, push against me again, good. And then I want you to spread your fingers apart, together, bend it out, in, and then fist, and then touch your finger, good. Now also was in expected findings there. And now we're going to move to your elbow. So arm up, straighten it, bend it, straighten it, okay. Range of motion is good there. Here, bend it here. I'm just going to palpate, ulnar your cranial process here. Work my way down the ulnar surface here. Good, no masses or anything felt there. I want you to bend it up like this and then all the way down. Good, range of motion is good there. Work, I guess we'll go to the shoulders from here. Oh, let's go back. I need to check range of motion here. Turn your hand over and then all the way over that way. Okay, good, good, range of motion is good. So now we're looking at the shoulders. Gonna check, just palpate, no masses or anything felt. Any tenderness in here? No? Good. Shrug your shoulders up, back down, shrug them up, and you can let them down. Alright, so what I'm going to get you to do is raise your hand all the way up, and then all the way back down, and then bring it out to the side, and then come across your body. So you got you to stand up for that. Stick your arm out, push down, okay? No, leave your hand that way. Push up, and then turn your arm aside, push in, and then push out. Good. Okay, range of motion and strength test is normal. Now we're going to test your jaw. Okay, go ahead and open, close, good. I'm going to palpate here, open, close, and then wiggle side to side. Okay, some popping and clicking noted, squeeze. Okay, alright, there's some popping and clickings noted there. That would be an abnormal finding. We would test further. You can go ahead and stand over here for me. We are going to go cervical spine next. So if you turn that way for me. Let me get you to turn this way. Yeah, facing that way. Alright, so now we're going to note symmetrical or symmetry of the cervical spine. No abnormalities here. Touch your chin to your chest. Straight up. Flex it back. Alright. Ear to shoulder on the same side or other side, I mean. Alright, now turn your head and turn it all the way the other way. Now turn it against turn it against here. Good. Alright, muscle strength is good. Range of motion is good. Push against this as well. And then over here as well. Okay, good. Now we're going to work down to the rest of the spine, the lumbar and thoracic spine. It is symmetrical. No abnormalities noted. If you will, bend down and touch your toes. Okay, and we're just noting here, it's symmetrical, no abnormality. Straighten up, bend all the way back. Good, and straighten up. I'm going to go ahead and palpate. Let me know if there's any tenderness in here. Any tenderness with that? No? Okay. I'm going to percuss real quick and just let me know if there's any more tenderness in here. Any tenderness? Okay. Lean down with your shoulder. Okay. And lean down with your other shoulder. And then twist at the hip. Alright. And twist the other way. Good. Any problem there? Nope. Okay, good. If you will, I guess, turn this way. Now we're looking down at the hips, the knees, and the feet and ankles. We're noticing some symmetry of the hips, the gluteal folds. I'm going to just touch you right here on the pelvis and see any tenderness or soreness there. No. Okay. So we're looking at the knees as well, noting muscle tone, symmetry, everything there, and then the feet. So I'm going to let you go ahead and have a seat again. Kick your foot straight out, and then back, straight down. Push against me, and then pull down. Good. And that tests the strength of the knees. And I guess we'll go ahead and lay down. All right, I'm going to pull this up just a little bit. We're going to palpate the knees, the popliteal space. Good. Okay. So the range of motion and the knee strength was good in the knee. And now we're going to work and go back to the hips. We're going to work our way back up. So there was no pain or tenderness in the knee or the hips. No? Okay. So straighten this leg, pick it all the way straight up. Good. Now come down a little bit. Now push it, pull it up against. Okay, good. Now bend your knee all the way up as far as you can go. Good. Straighten it down. Pull against me. Good. Okay. Foot flat on the ground. And take it across your body without pulling the hip up. Good. Come back straight. Push against my. Good. Now pick this foot up. Push it across your body. And push this knee down. Good. Now lift it up. Push it down again. Good. Now test the strength and range of motion of the hips, and that is within normal findings. I'm going to pull this out and look at your feet. Straighten your other leg. I'm going to take your sock off, okay? Check your foot, your ankle, your Achilles, and note everything on the foot. So just check the Achilles. You're going to look and inspect, noting symmetry. There's no masses or swelling, anything in here. Check the metatarsal spaces. Okay, so pull your foot up and then push it down. Pull it up against my hand and then push it down. Bend it. Can you sit up for me? And then bend it, and then take it. Try to just the ankle. Pick this side up. In and then out. Okay. That's a normal finding on the range of motion for the ankle. All right. Anything else for this assessment that you have questions about? No? All right. That's it.